The American Society of Black Neurosurgeons, one of our goals is to highlight some of the inequities in care in the U.S. and around the world. Our goal is basically to try to identify those inequities and see what we can do about it.
Patients do better when they have doctors of similar cultural, ethnic backgrounds. And while it is not to say that only Black doctors can treat Black patients,
having a workforce, a physician-provider workforce that is concordant with its patients optimizes outcomes.
I think one of the biggest challenge is the healthcare system in the U.S. and the fact that not everyone has access to healthcare and not everyone is insured. It does impact their care if they can't afford to buy the medications that are prescribed.
I think that the political determinants of health and social determinants of health can have adverse impacts on some patients and directly impacts their patient care.
The trouble with this kind of work has always been it's very difficult for the individual to hear that kind of information because it's thought of as an individual attack. But there really isn't much room for that, right? The problem is with the systems. It may not be possible to end up with a absolute concordance. Instead, we can have functional concordance, which is what I think is very important. I think that the providers need to be aware of, sensitive to, and willing to deal with issues that result from different people from different places, different walks of life.
I think the systemic challenges are addressing that the challenges exist. And that is how ASBN is trying to really impact it by shedding a light, by doing these earmarked research projects that are not historically done.
So I think it's extremely important that we think about the social determinants of health and even the political determinants of health with each patient touch point we have, so that we can make sure we're providing the resources and educations patients need so that no one is left behind.